Thank you all for joining us. My name is Erin Tinnen with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar, What's Got to Do with It? Domestic Violence and Health Advocacy for Women of Color in Ohio. Our trainer today will be Terri Pease, Senior Training Consultant for the National Center on Domestic Violence, Trauma, and Mental Health. Before we get started, I'll go over some of the technical details of the WebEx software that we will be using for today's webinar. Many of these details are also explained on the Using this WebEx System tab on the upper left-hand side of your screen. Please be aware that your screen might look a little different depending whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. The second from the top is the chat feature. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the trainers or myself if you have any questions regarding the training content. You may contact Jennifer Curley, also with the Center, if you have any questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you would like to contact. You will see a lot of options, but for this session, you'll want to select all participants if you'd like to respond to a question from the trainer or contact me anytime during the session. You should click on Jennifer Curley to privately contact her if you're in need of troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go to the chat box, click on All Participants, type in the program you are calling from, and then press Enter. Give folks a second to do that. Just make sure that it's working. All right, I'm going to go, oh, perfect. There's someone. Thank you very much, Jen. Excellent. Thanks, folks. I appreciate you doing that. While folks can get a lot out of the chat feature, there are times when it moves really quickly and can feel a little bit distracting. And if this is true for you, you can feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a media viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word media viewer, the same way you might if you want to hide the chat box. At the end of the webinar, you'll be taken to a very brief evaluation. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call in if that becomes a problem for you. If you're experiencing technical difficulties and are unable to contact Jennifer Curley, you may call WebEx Tech Support to resolve any additional issues. That phone number is 1-866-229-3239, and we will also post this in the chat box. Again, thank you so much for joining us today, and I will now turn the training over to Unjung Lim, Outreach Coordinator to Underserved Populations at the Ohio Domestic Violence Network.
Hello and good afternoon, everyone. My name is Unjung. I'm the Outreach Coordinator to Underserved Populations here at the Ohio Domestic Violence Network. I so appreciate everyone who's online today. We had over 100 people register, and we have currently 49 people on our webinar this afternoon. It is a beautiful snowy day, and we so appreciate you joining us for our webinar to hear Dr. Terri Pease speak about how to best work with women of color who are experiencing domestic violence. So I'd like to talk a little bit about what the Ohio Domestic Violence Network does here as a state coalition. We are a program that definitely far reaches of the state. We work with over 70 DV shelters and programs. And our membership is very, very diverse. We are made up of local domestic violence programs, culturally specific organizations, and definitely many different professionals across the gamut in different fields. We provide training, technical assistance, and resource sharing through our library, both online and in our office here in Central Ohio in Columbus. We also do a lot of very important public policy work to both do intervention and prevention work in the field of domestic violence, sexual assault, and stalking. So when we're talking a little bit about today's webinar, we want to make sure that we understand that there are some major objectives that we would like to touch upon. One, we would like to make sure that people are both learning and identifying and understanding different ways in which we can provide best practice services and support and advocacy for women of color who are experiencing domestic violence or enduring domestic violence. One, we would like to learn 3 challenges that women of color who are survivors experience. Name some strengths. I think that's very, very important to make sure that we are understanding that survivors are experts in their own lives in terms of understanding what survival means to them in their own lives. Identifying at least 3 important reasons for providing appropriate referrals, advocacy, and services to diverse survivors of domestic violence. And then, of course, we want to be able to put these things in practice, and how can we discuss ways to actually provide at least 3 ways to advocate for women of color and those who are experiencing domestic violence in your program, shelter, or organization. Because we have a number of different people online today, we certainly want to make sure that people are feeling interactive. Please feel free to ask any questions when it comes to this particular subject matter. We want to be able to hear your questions in the chat function. Because we are a state coalition and because we have such diverse folks online today, we want to make sure that if you are asking the question, if you can just identify maybe the particular program that you may be from. Not necessarily the name of the program, but if you are a DV program, if you are a sexual assault program, if you are a social worker, or if you work in the attorney's office or do legal services, we would love to hear from you because we know that your perspective in working with survivors of domestic violence may be different and unique. So just to introduce in terms of understanding our baseline in terms of domestic violence, we usually like to make sure that everyone on the program and on the presentation understand what the social definition of domestic violence is, just so that we all have a clear understanding of the differences between the social definition and the legal definition. So when we are talking about the social definition of domestic violence, we are talking about a pattern of assaultive and coercive behaviors, including physical, sexual, psychological attacks, as well as economic coercion that adults and adolescents use against their intimate partners. Now, when we talk about the legal definition, just please note that there are quite a few differences when it comes to the legal definition, and understand what is left out when we're talking about the social definition. So the legal definition of domestic violence here, as the Ohio Revised Code definition states, is that it is a criminal law defining domestic violence as doing any of the following to a family or household member: knowingly causing or attempting to cause physical harm, recklessly causing serious physical harm, and by threat of force, knowingly causing another to believe the offender will cause imminent physical harm. And so the definitions are quite different, and it's important for us to differentiate that when we are talking about working with women of color and how we are able to best support those survivors who are coming to our shelters, to our culturally specific programs, to our mental health services, and acknowledging that even if it is not something that may be defined as the legal definition of domestic violence, that we absolutely understand and believe that women of color who are survivors of domestic violence absolutely understand that the social definition applies to them, that it is not just about the physical coercion, it is not about the physical abuse, but that it is all of the different patterns of assaultive and coercive behavior. So with that, I have the pleasure of speaking about Dr. Terri Pease. We have the fortunate benefit of hearing from her expertise for her many, many years working with the National Center on Domestic Violence. and trauma and mental health. She is the senior training consultant, and we have the pleasure of hearing Dr. Pease speak. And we hope that, again, if you have any questions, both locally and also nationally, that we would like to be able to answer those questions for you. If I don't have the answers for you, I will certainly do my best to get those answers for you in a follow-up email that we would like to provide after the recording of the webinar. So I would like to take it over to Dr. Terri Pease. Thank you so much.
Hi, folks. It looks like there's a problem with Terri's sound, so we're going to try to work on that. Just a second.
Hi, this is Terri. Did it help if I turned off mute on my phone?
It did. Thanks.
Yes. Sorry about that. I had it on mute so you couldn't hear the vacuum cleaner in the back in the distance. But okay, let's start. Hi, everyone in Ohio, and I'm very, very happy to be have the opportunity to talk to all of you about today's topic. We will be together for about an hour and a half from now until 2:30, and hopefully we will be able to accomplish the goals that were described on the slide that Anjan presented, but more broadly than that, to be able to think about what is it we bring that women of color need. And for me, I think that is the broad question as we do this work. So with that, let's look at this title, which is a place for us to begin. And the title is, What's Got to Do with It? And I'm curious if you can tell me, as you saw that title and looking at it now, what did you mentally put in the blank? And if you would use the chat function to type in, and somebody I hope will be humming Tina Turner in the background as we do that. But what else besides the Tina Turner What's Love Got to Do with It comes to mind when you think about the issue of domestic violence and mental health advocacy, working specifically with survivors of domestic violence? And I still think about both her story, the film, and her Tina Turner's own story about domestic violence, and it's one that sort of culturally looms large for all of us. But questions also that are coming into the text now, into the chat box, are what about mental health, race, being a woman, my past? What does that have to do with what's happening to me now? These are great. And one of the things that I think, if we were only going to make one point and then go home, it would be that each survivor's full experience is important at every moment in her work with us. And we will think about that and talk about that throughout the time that we're working together today. Just a quick point before we jump in about who we are from the National Center on Domestic Violence, Trauma, and Mental Health. We are supported by the Department of Health and Human Services, FIPSA, Family Violence Prevention and Services Program, as a special interest resource center, which means we are here for you. We are here to offer technical support, training, resources, and use our website as a central conduit for that to help all of the folks who do the hard work, that is you, think about and respond to domestic violence, trauma, and mental health issues, concerns, that arise in the lives of survivors of domestic violence. And while we are funded to address domestic violence, I always like to say that in the lives of survivors with whom we work, there's no bright line between domestic violence, sexual violence in their lives. And so if you are primarily a sexual violence advocate, most of what you're hearing today is directly relevant, I think, to your work as well. How many of you, another question, how many of you work directly under the label over your door is domestic violence? And Jen, can we do hand raises? I don't know if we can. We may not be able to. Let me ask that question a different way then. How many of you, can you type in, if you're not from a domestic violence program, what other kinds of programs are represented here so that I will have a sense of who's here and who's listening? And I'll look at the chat window for the answers to that question as we move forward. So here's how I think about the goals of the webinar. How do we address the mental health needs, the trauma needs, the advocacy needs of survivors, including survivors of color? Because, again, just like there's no bright line between survivors of domestic violence and survivors of sexual violence or those experiences in the lives of the people with whom we work, it's also the case that survivors of color are not some monolithic group that's completely different from the broad range of survivors with whom you work. And so with that in mind, when a survivor's experience as a woman of color looms large in how she communicates with you, what she asks for, what she experiences, your knowledge will help you to do a better job of bringing resources and ideas and suggestions and references and referrals that survivors need. So welcome to all of you. Some of you are from higher education, some of you are from social work, some of you are working peer-to-peer, and I assume that that means peer support in the context of survivors of psychiatric treatment or psychiatric services. Welcome to all of you. So I'd like to also ask you at the very beginning to follow these agreements and then to suggest any other agreements, because as soon as we start to talk in this country about issues of race, it gets to be a little uncomfortable sometimes, because we really haven't yet learned in our country how to talk from an honest and open and accepting place about issues of race. So I really think it's helpful as we talk about this together today, and those who listen to this webinar afterwards, to approach this conversation by remaining open to discover your own reactions and your ideas from a place of honesty and a desire to learn. I'll ask you to do your own work so that you're focusing not on what the person across the table or across the room or on the other side of your building needs, but what are your needs in order to be able to do this work well. A sense of privacy is really important, especially if I ask you to talk about challenges or experiences, to make sure that you're maintaining other people's privacy by not using names or identifying details, and make sure that each person has ownership of her own narrative. So if someone or his or her narrative tells a story here, that doesn't become conversation over your dinner table tomorrow. And finally, something that I've heard called amnesty. To ask you all to agree that the work that we do together here, the conversations that we overhear, will not be used to other people's disadvantage. So I will ask you to type in yes if these are agreements that you can sign on for the time that we're working together. And in addition, can you also suggest any other agreements that we ought to add to this conversation before we jump in? Things that you need from me as a presenter here. And thank you for all the yeses that are coming into the chat box. Any other agreements that we should be adding? We can come back to that if anyone adds another agreement, things that we would need from ourselves or from you that you would need from us. So please do add them, drop them into the chat box as we go on. And now here is a really central part of what we want to do. What brought you to this webinar? You know, sometimes it's because your boss said, go to this webinar, but many, many more times it's because there's something that you are concerned about or something that you want to learn. What are questions that you have? What are concerns or challenges that you face that caused you to think this webinar might be useful for me? I might be able to do my work better. I may be able to understand things better if I come to this webinar. And I'd like to type those in as we hear them. And this is the moment when I always think I should have that little song from Jeopardy. Da, 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 da. Any comments? Okay, so providing training on culturally relevant services. Great, that's an important point. Being able to we'll see if I can do this. How do we make our work culturally relevant, and how do we help other people learn how to do that? To be more informed. I've been told that DV is almost a norm in the Black community. That's a really important question to ask. Is DV a norm in the Black community? Learning to support survivors of domestic violence who are experiencing domestic violence. And I think these are primarily the questions. Barriers for Latino women and the lack of cultural sensitivity with other agencies, and Latino women's barriers as well. Now, I have to say that because of what I understood about the demographics of Ohio, I am going to be talking about primarily African American survivors. It's my experience, and it's the place where I can speak with the most expertise. So I apologize for not being as precise and as knowledgeable about the needs of Latino women, but I think the way that I'm presenting this, I'm hoping that Latina women and Latino people's needs and concerns will also be relevant and addressed. I think one person has made a really important point. Someone said, I've heard that domestic violence is a norm in the Black community, and I think if you look around in the United States, I would have made exactly the same point, which is that domestic violence is a norm in the world. And while maybe it's the case, and I'm not even sure that I would say that it's the case, that domestic violence has a particular shape in particular cultures and communities, it is the fact that domestic violence is just there. And while I just saw a statistic from Futures Without Violence saying that domestic violence has actually dropped over the last 30 or 40 years since we've been doing the work, there's still plenty of it out there. And so I think if we begin by recognizing that while, even if it were the case that, in quotes, domestic violence was a norm in some community, how does that change how we approach the individual survivor who is sitting in front of us? How do we work with communities? And one more point is working with young people, with juveniles. I'm not sure what AOD refers to, so if that person who made that comment can explain AOD, that would be helpful. Thank you. We're not primarily talking about, alcohol and other drugs. Thank you. Young people who are using substances. And we'll talk a little bit about substance use in the context of this work as well. So with those thoughts in mind about why are you here, it sounds to me like you want to know, how can I do my job better? So I am going to talk to primarily the issues of African American women. And let's make sure that we leave some time at the end to try to talk in more detail about particular questions or answer specific questions. Something I'll say at the end, and that I'm also going to say right now, is that this is only an overview, and I will refer you to a number of resources that will be helpful to you to expand, and I'm hoping that this webinar gives you a starting place. So I want to first ask you, when you think about African American women, what images come to mind? In our culture, all too often, the three pictures that are on this page still today are the images that anchor the public face, the cultural position that African American women are placed in our culture. Mammy, the caretaker; Jezebel, the sexually seductive woman; or Sapphire, the hard, unyielding, unloving wife or partner in a couple's relationship. All too often, those stereotypes shape who we think of when we think of African American women. And if I were asking you that question about African American men, you would see what? Either the thug or the lazy, disconnected person who has nothing to give to his children and his family, or the criminal. Or the basketball player, the athlete. Those would be the pictures I would put up if you were thinking about African American stereotypes and cultural sort of archetypes. But in fact, let's take the image of the Jezebel. That shapes how we see, all too often it shapes how we see African American women. All of us are sexual, but African American women's sexuality gets brought to the forefront. This picture I always think is a really important image of how African American, even young girls, are seen as cocking their hips and somehow being a little bit seductive, whereas the more innocent children of other ethnicities may not be seen in that way. This image always resonates for me as a way of talking about that. And yet, if you think about young African American girls, these kids, having a good time, laughing, enjoying their friends. That's who kids are. African American kids, Latina kids, girls and boys, Latina and Latino kids. Kids all come from that position. And it's important as we're thinking about African American women and girls that we remember this is who we're talking about. That image of Mammy is also in the culture. And if you think about current movies or recent movies, you'll find examples of that. I think the Tyler Perry Medea character is one that is a modern-day version of Mammy. But I always like to ask people also, as you're thinking about the women of color, the African American women or women of color of other cultures who come to your programs, to also think about the fact that this is a stereotype. This is a real Mammy. This is a young woman in slavery caring for a white child, and look at her face. Look at her hands. Think about who she is. Look in her eyes. And remember that these cultural images, which are not only endorsed by people from the majority culture, but are also endorsed. In one study, Tamika Gillam's study, 66% of African American men she surveyed subscribed to the idea that Mammy, Jezebel, Sapphire are characteristic of African American women. So keep that face in mind. Keep that face in mind of an African American mother as we're doing our work today. Take this protective picture and keep that in mind as well as you think about who are the survivors of color that we're working with. And just to go back for a second, if you take that Jezebel image that I showed on the screen a little bit ago, you can also think that the stereotypes of Latina women are often stereotypes of the hot Latina who's highly sexual and a little bit flippant and, again, otherizing and putting survivors whose ethnicity looms large in the observer's eyes as being somehow sitting in these boxes rather than being people, whole people who come to us with their entire story. So with that in mind, any thoughts or comments about that before we move on? Okay, let's move forward and then start to think about survivors and mental health and their mental health needs as we're looking at our work in advocacy, our work in domestic violence, sexual violence advocacy, and moving forward with these topics in particular. Okay, just one slide that I have from Carol Warshaw, who's the director of the National Center on Domestic Violence, Trauma, and Mental Health, and who can talk to us for a day about the details of how domestic violence and mental health diagnoses intersect. But this one slide from Carol helps us to understand that if you're looking at survivors of domestic violence, how common is depression? 50% prevalence. How common is suicidality? 20% prevalence. How common is post-traumatic stress disorder? 61%. And if nothing else jumps out at you from this, I hope what jumps out at you is this, that the odds are really high, and these are not exclusive. It's not like a person could be just depressed or just suicidal or just having symptoms of PTSD. If you put these together, it suggests to you that most survivors of domestic violence who come to us experience mental health needs. I sometimes remind people that when we started doing this work 40 years ago, when I started doing this work, 40 years ago, I could hold all the books on domestic violence in one hand and all the research papers on domestic violence in the other hand. There was very little known about that. That was in the days before Oprah. That was in the days before the Internet. And so back in 1978, or whenever that was, it wasn't possible for survivors across the board to reach out for information about domestic and sexual violence outside of the services offered by domestic violence and sexual violence advocacy programs. And so the people who came to our programs were people who had a much broader range of wellness and a much broader range of resources. Our colleague Leslie Landis in Chicago sometimes uses the phrase, well women in crisis. And that is kind of the model in mind that we sometimes have when we're doing domestic violence work, that Well, our services are designed for someone who's a well woman otherwise, but who's in a crisis related to sexual or domestic violence. And I think where that leads us, if we're not careful, to believing that all we have to do is address domestic violence or sexual violence narrowly, and then the survivor can get her wheels under her and get moving on in her life. And we tend, if we're not careful, to think of those as being, in quotes, good victims, good survivors, close quote. And the many, many survivors who are not able to use today's resources, the internet, television, goodness, you can be on a sports channel and hear about domestic violence. The people who come to us for services now are people for whom those easy-to-reach resources are not sufficient. And where that leads us, I think, is the understanding that the survivors of domestic violence who come to us with depression, post-traumatic stress disorder symptoms, who say, I think about doing away with myself, who feel like they just don't have the emotional and organizational and cognitive resources with which to move forward. That's who should be coming to us for services. And if we are seeing survivors of whatever ethnicity who come to us asking for help in a state of depression or in a state of suicidality or with PTSD symptoms keeping them awake at night and making them so jumpy they can't even get on a bus to go to the welfare office, that's who we should be serving. And then I want to add to that perspective the information that's come from a newly published survey from the National Center and the National Domestic Violence Hotline. And I will not do justice to this incredibly important study in just a sentence or two, but in brief, survivors who called the hotline, the domestic violence hotline, and who were safe enough to have this conversation, and who were willing to answer these questions, were asked about behavior by their abusers that was crazy-making behavior, that was accusing them of somehow being impaired by mental health or, in a separate survey, by substance abuse, threatening them to report them to authorities because of use of substances, threatening to report them to authorities as being crazy, and actually doing things, what we used to call gaslighting from an old movie called Gaslight, to actually make someone feel, in quotes, crazy. 88% of hotline survey respondents had experienced at least one of the forms that the survey asked about of mental health coercion. Many survivors experienced that their partners, their abusers, stopped them from reaching out for services, undermined their abilities to stay sober. So if someone comes to us experiencing mental health symptoms, or as I remember hearing someone say, someone comes and says, well, I'm bipolar. I've got bipolar. How do you know? My partner told me I did. I hope we know to take 15 steps back and say, whoa, wait a minute. Let's put the labels aside and let's talk about you and how you are and how it is that you are still breathing and here and what we together can do to help make things go better for you. Jen has just put up the link to the survey in the chat box. It's available on the center's website along with all sorts of other really, I think, amazing documents and resources created by my colleagues there. There's just a wealth of information that will help to expand on the things that we are just introducing here today. So what we're saying, first of all, is that if we take the standards of the Diagnostic and Statistical Manual, we understand that many survivors come to us meeting those criteria. And remember, the DSM is not a Bible. The DSM is not the last word. The DSM is a manual for applying diagnoses to people's lives and to people. With that being said, it's also the case that experiencing one's distress as mental health needs is cultural. It is a cultural thing to say, if I can't get out of bed and I am just too undone to be able to do anything, that's a sign that I have a mental illness. In other cultures, that same experience might be described as a spiritual crisis. It might be described in different terms. If you are a Latina, you might know the expression, excuse my Spanish accent, ataque de nervios, an attack of nerves, which is not understood as something that a mental health professional needs to respond to. And in other cultures, there may be other ways of explaining what is distressing us. So with that being said, it's important to understand that even if a survivor of domestic violence, an African-American survivor, has something that she, in her own language and her own view of herself, recognizes as being appropriately discussed as a mental health need, or has something where we as professionals and we as people offering support to this person think it may be that this mental health program, that this mental health provider may be able to help you feel better. There are still things that get in the way. Things like access. If you are living in a poor community, if you are living in an African-American community, the odds are that you may not be able to find services near at hand. You may not have the funding to pay for it. You may not have health insurance. You may not have transportation to get there. You may not have child care because you can't bring your 3 kids with you to a mental health appointment and have any kind of well-focused conversation. Availability, there simply may not be mental health services available. There may be waiting lists so that a person who is in a psychiatric, a mental health crisis who needs to be seen today may not be seen today because the services simply aren't there. The quality of care may be poor. You could be in the position, as I can remember being in, where I was working with survivors who wanted and needed help from mental health professionals, but I didn't have confidence that the mental health professionals that I knew, and this is going back 30 years, in the communities where I was working, and that I did not have confidence that the mental health providers understood domestic violence well enough to not say, well, what are you doing to make your husband, your partner, do this? So the quality of care can be so poor that you may have real hesitancy about referring someone for mental health services. And that's true whether survivors are African American or Latina or Asian or any other ethnicity or any survivor. And then there's the issue of cultural matching as well. I mean, I'm of 2 minds about this because on the one hand, if you're looking for help and a person is able to be helpful, their culture should not, might not, be a barrier. But that's a two-way street. It's not just whether I, as an African-American woman, can work comfortably with a majority culture, with a white or Latina or an Asian or other ethnicity therapist, clinician, psychiatrist. But can that person see me from a neutral stance? Or will that person see me through a lens that says, this is an African-American woman. I already know stuff about her before she's opened her mouth. And if that's going on, then cultural matching is really important. So these things stand in the way as well. I'm imagining that you've had that experience. And, you know, someone is making a really important point. At times, a person of the same background, the same culture, could aggravate the problem. For any number of reasons, thank you for that comment. It may very well be that someone from a majority, from a cultural match who is not knowledgeable about domestic violence may make a person feel like I'm betraying my people, my culture, my community, my family, my religion by asking for help, by telling the truth about the domestic violence in my life. And so I think that's a really useful point. Thank you so much for making that point, that we can't just assume, oh, well, you are from Barbados, and I happen to know a therapist from Barbados, so of course this is a great match. We need to look and pay attention. And something that I hope I'll say later, but I'll say now, is that we, as providers of domestic violence services, should not be waiting till the minute that we're ready to pick up a phone or write down a contact information to ask, how is this program, this service, this mental health program going to meet the needs of the survivors with whom I work? That's a question I hope you asked yesterday, and I hope you will ask immediately after this conversation, talking to the other people in the room with you, talking to your colleagues about what you heard here, that we need to know who in our community can do a good job of working with survivors of domestic violence, the survivors of sexual violence. And I hear some of you who are on the chat who are working in mental health services or peer services or corrections or the criminal justice system or the legal system are asking, how can we do this work well? Now, there's also something I think that's really worth paying attention to in the experience of African American women. And this is a quote from a respondent of a study, one woman who was responding to a study about the attitudes of African American women about mental health services, about therapy and psychology and psychiatry. And this one survivor said, this one woman said, we as African Americans were always taught and always raised that you're not going to have it easy. You are going to be at a disadvantage. You're going to have to be tough. You're going to have to deal with problems. You have to be a strong black woman. And that's something that I hear a lot. I experience myself because, in fact, this is a reality of the history of African American people. And while this is not true, someone is making the point, and I think it's a really important point, not every African American survivor you see comes with the same experience. The African American community is an extremely broad community and with experiences that are as broad, really, as the mainstream American culture. But in general, I think it's reasonable to say that African American people walk out the door every day knowing that something tough could happen. And Faye Childs and Noreen Palmer, in their book called Going Off, have pointed out some of the ways in which this can really undermine wellness no matter what else is going on in a survivor's life. The feeling of being ready to go off, having physical symptoms that may be unnamed, having hidden depression and the expectation and need to keep up a strong front but feeling isolated and numbing oneself out. Now, these are not exclusive to African American women. They are also present in any person who feels that she has to swallow her experience and silence her reactions. These authors also say that the expectation of being that strong and invincible black woman causes African American women to take a stance of taking care of other people's needs first, of not saying no, that keeping up an image is important, not letting anyone see how vulnerable you may feel. And there may be a sense of disillusionment about connections, not only intimate relationships, partner relationships, but any kind of connections with other people, the sense that it's not going to work. And of course, like any of us, people who are under stress and in distress may reach for drugs, alcohol, spending, and other kinds of activities that tend to soothe and regulate the sense of distress. And so it may be very difficult to listen to others, to connect with others, to make use of resources around us. But it's also important to understand that that very same challenge that we saw a couple of slides ago, you're always going to have to be strong. You shouldn't expect it to be easy. Problems are going to come. Also can be understood and has been shown in research, actually there in Ohio, Dawn Johnson at the University of Akron, I believe she is, has done research on empowerment and survivors of domestic violence and an empowerment model for reducing PTSD symptoms for survivors in shelter. But Dawn Johnson's research has also pointed out that African American survivors have a kind of readiness to show strength, what was just described, a sense of not automatic, I don't want to say automatic, but intentional coping that surprisingly lowers the level of distress given a certain level of domestic violence. Now, I want to say this very carefully. I don't want to suggest that somehow African American women are so tough that even in the face of domestic violence, they don't have symptoms, we don't have symptoms. But there are resources that come with the life experience, the cultural experience, and the cultural supports in the Black community that mean that a survivor may have a way of reaching out that you might not recognize, and especially if we don't ask, we won't know about. So I want to be very clear that African American women should not be seen as somehow survivors with extra challenges. Like we've got regular survivors and then we've got survivors of color who have all these extra challenges. We have people, one at a time, communities with whom we work. And while we understand these forces that are associated with a particular cultural experience, they should not really shape what it is that we provide, because if we are listening to individual survivors and asking some of the questions that I'm going to suggest later today, then you don't have to have specific cultural knowledge. We're going to talk about cultural humility as a stance that allows us to approach someone from a culture we may never have encountered. Now, quickly, I want to move on to just suggesting what is a model of advocacy that makes that position possible. I use these three graphics to try and talk about the fact that sometimes, just like these two guys climbing up what I guess is a corporate ladder, we sometimes can approach our work with survivors of domestic violence as though we have a clear goal, we know where we're going, and all we have to do is drag the survivor up the hill with us. And if you've had that experience of working with survivors from that stance, you know what it makes you feel like, to feel like you have to drag someone towards a goal that you think is important. How many of you have had this experience of trying to pull someone to a place that you think is really helpful for her? Have you had that experience? Where you feel like, if only I could get that person to go this way, things would be so much better. And we do that out of the very best intention, which is to offer supports and help that we think will make a difference in our work with survivors. Many of us have had that experience of feeling like we're pulling survivors uphill. Or we can feel very often, and our funders certainly, and policy situations can certainly put us in this position where we're standing there with a megaphone saying to survivors, jump through this hoop, now this one, and if we're working in concert with the child welfare system, some of the most heroic people I know work in child welfare. But that system also can create a situation where survivors are being asked to jump through hoop after hoop after hoop. And you know how exhausting that is, to try to engage with people where you see a whole series of steps they have to take, goals they have to reach, as though somehow if they do that, once they dive through that last hoop, they'll be home free. You may have had this feeling as well. And someone's reminded me that the research that I just talked about is Dr. Dawn Johnson at the University of Akron, yes. I like this picture a whole lot because for me, it exemplifies the empowerment model of services for survivors of domestic violence, for survivors of sexual violence, and really for anyone with whom we work as paid helpers. This picture I call Reaching for the Stars. And I sometimes talk about this for a very long time, but I'm just going to very quickly say that whenever we are working with someone, together we are working to reach for stars, and we are helping people to reach stars. In working with survivors of domestic violence, we can ask them, if you were to write on the stars you want to reach for, what would you write on these stars? And where should we reach first? Putting the survivor in the driver's seat. And when I use this graphic, I also say we have stars as well. We have to make sure that we've filled out the paperwork that helps to keep the doors open, and it's completely legitimate to say that. Great. And I also need to let you know, I say in my voice of being an advocate, I also have a couple of pages that I have to fill out in order to be able to offer you these services. So let's add that to the list of things that we have to accomplish in the times we're here. But I hope you will never say to a survivor, you need to fill out this form, because she doesn't need it. We need it. And I hope that you will absolutely say, we have a form that we need to have filled out, which is much more honest and presents to a survivor the fact that, yeah, and believe me, the people with whom you work have already dealt with bureaucracies and understand about paperwork. But owning that responsibility means that you're beginning to take an empowering stance in your work with survivors. So here's the definition of empowerment, and there are many of them out there, but this one I think is a good place for us to work. Empowerment is a social process. It helps people gain control over their own lives. But it also means that it fosters power for people. And once I remember doing a training somewhere where someone said, well, this is what we say to survivors. You have to do this and this and this and this. And no, I'm not going to give you a ride because we are an empowerment-based program and you have to do it on your own. Empowerment does not mean, empowering people does not mean a hands-off approach. It means strengthening every skill and capacity that they have and every resource that they have and providing resources they don't have. That's empowering, providing skills and information and easing the way for people to use the skills and resources and to have power over their own lives. So please don't take an empowerment model as meaning that there's nothing for you to do. Otherwise, you might as well be a computer and just give somebody information and hand them resources and telephone numbers. So in summary, if we think about what is a model of advocacy that you can use in your work with survivors of color, you can ask yourself, do I want to work jointly with survivors on a project of their own choosing, which might be getting enough sleep, which might be figuring out how to get sneakers that fit my kids, might be figuring out, as someone said in an example of a training I did just the other day, making sure that there were clean clothes because the kids have to start school tomorrow. And until I get my laundry done, I can't fill out your papers, lady. My kids don't have clean socks. So what is her choosing? Rather than offering survivors our solutions to a problem, and all too often a problem that we have defined. So now there's a really interesting new document that's been published by a group called the Full Frame Initiative. And a couple of slides here about their study, and I'm going to do this really quickly again, and at the end I'll show you the link to read their whole study. But basically, they did a series of workshops with survivors, DV survivors, and with practitioners and policy people in California. And they also did a pilot where they worked with survivors from more diverse cultural groups. And in all of these conversations, which took them a couple of years to accomplish, they wanted to know, what do survivors want out of us? And quickly talking about the findings that they had, what's so interesting is that for survivors of domestic violence, their primary identity is not as a survivor of domestic violence. And I think it's especially true for survivors of color, that the notion that what's going on in my life, A, has a label of domestic violence, is our idea as advocates. And maybe she'll say, okay, I'm going to sign on to the label domestic violence because it helps me get services, but don't call me a DV survivor as my primary identity, unless I choose that as my primary identity. I'm Lucy, I'm Linda, I'm Janetta, and that's who I am. In this study, only 7% of their survivors, they asked survivors to talk about a moment of success. Only 7% of the stories that they heard were about changes in the abusive relationship. For them, moments of achievement did not equal I left. Instead, for survivors, what was important? What was important, let's see if I can do this, was connection and achievement. And so as you approach survivors of any ethnicity, but especially survivors of color, rather than asking, how can we help you end the DV in your life even though your funders are in the background saying that's why you're there, to also ask, how can we help you find the connections, find the achievements that will make your life feel better? And I suspect that as you ask those questions, survivors may see domestic violence, either domestic violence from the legal definition that you heard earlier from Anjung, or domestic violence from a social definition, as a barrier. And when it's experienced as a barrier, they would say, well, I would be happy to make these connections and have these accomplishments and get to these goals, but the domestic violence is a distraction. It's not an identity. It's a distraction, but not an identity. And I want to back up and make a comment about what Anjang said about definitions of domestic violence. And this is related to a conversation that I had just recently with a woman named LaVon Morris Grant, who's the author of a couple of really interesting first-person narratives about her experience as a survivor of domestic violence, who, by all rights, should have been one of those statistics of having been killed by her husband, who then killed himself. And she would say, through the grace of God, she survived and has become an activist and speaker. But LaVon reminded me that for survivors of domestic violence, survivors of color, there's another, well, let me back up and say this differently. Families may be combative. People may be accustomed to being aggressive with each other, physical with each other, and despite that, when we present a social definition of domestic violence that has to do with power and control, may not be willing to say what I'm experiencing fits your model of domestic violence. I love the power and control model. I think it's incredibly valuable. But I also think it's important that we let survivors define their experience as we are educating them to how we see domestic violence globally. For us, the third point of the study is that the transition from victim to survival is central to us. But for survivors, that is not the central thing they're hoping for us. And this was true across geography, across culture, and across different parts of California, different social classes. But what was interesting also was that the Full Frame Initiative folks tell us that the practitioners with whom they work wanted to hear more about that. And I think your presence here is the same thing, that you want to know more about how to present services and supports that actually are meaningful to the survivors with whom we work. Here's the information for getting the full report from the Full Frame Initiative. And I think we can probably get that link onto the chat as well, but it's fullframeinitiative.org. So 3 things that we talk about at the National Center that together focus on providing the kind of advocacy that we've talked about here today are cultural humility, reflective practice, and trauma-informed practice. And in the interest of time, I am going to focus our conversation primarily on cultural humility. We have many trainings in the National Center website on reflective practice, other webinars, and I invite you to hear those and learn more about what I'm just going to passingly discuss. And trauma-informed practice is an enormous topic that I hope you will take advantage again of the resources from the National Center to learn about trauma-informed practice. But very, very briefly, trauma-informed practice is about helping to figure out how a person who has been thrown off balance by the events in her life, recent or long-term, and who can't get back on the wheels of her skateboard by herself, figuring out how we help. What is trauma-informed practice? It does not mean psychotherapy. What it does mean is recognizing that when someone's up in the air because of the events of her life and her own balancing resources are not sufficient, we can do something to help. If she's on a skateboard, it's going to depend on, is she going to land on solid cement? Does she have a good income? Does she speak English? Does she have documents? Does she have healthy children? Is she employed? Or is she going to land in wet sand or even concrete? Does she not have English? Does she not have documents? Does she have a child who's in desperate need of solid health care? And so is she going to, same imbalance, but is she going to land in a place where under no circumstances could she just skate off, stay on balance by herself? Trauma-informed practice is recognizing how pervasive trauma is and that trauma can affect how a person experiences herself. It's not just, oh, this bad thing happened to me and I keep remembering it. It also is that it's really hard to feel human connections. It's really hard to feel like I'm worth anything, like I deserve anything. And it's really hard to recognize and tolerate all of the emotional and psychological and material storms of life. When we are trauma-informed, we take seriously the pain and the suffering that people bring to us. And we see the issue of a survivor's thriving as being a collective affair, and our empathy is a critical tool. It's not enough. It's not the only tool, but our empathy is a critical tool. So when we're providing trauma-informed practice, we recognize the presence of trauma and trauma responses, and we ask the third question here, which is the important one in trauma-informed practice. It's not what's wrong with her, but what has happened to you, and how has it affected you, and how can we help? So again, in the interest of time, I'm not going to do this with you now, but I'm going to ask you to think about a situation that you might describe as a mental health issue and reframe it in terms of how a person is struggling with feelings and emotions, with thinking and processing, and with difficulties in human interaction. Because when we reframe mental health issues in these terms, we figure out how we can help. And it's also useful to understand if a person is staying away from other people and is extremely suspicious and not willing to take seriously your offer of help, is that a mental health issue? Does she have a personality disorder? Is she, in quotes, a borderline? Or is this somebody who's discovered even the people who seem safest could turn around and hurt you? And so you need to be careful. You need to look out and hold yourself back. So I encourage you, unless you are someone who is licensed to diagnose and treat mental health issues, to recognize that no matter how symptomatic a survivor is, you can work with her as she is to offer what you can offer, what your skills and your experience and your resources have to bring to her needs. And then together, the two of you going back to that reaching for the stars can ask, what else would help you? Would talking to somebody who could give you some new ideas about how to manage these symptoms help? I wonder if maybe there is medication that could help you feel not so worn out. But please never medication to help you manage and shelter better. Please never medication in order that you can get our services. Please take a look at some of the materials from the National Center. I feel like I'm doing an infomercial. But please take a look at some of the materials from the National Center on medication policies and on addressing the needs, the mental health needs in more detail of survivors of domestic violence. My focus here is on cultural humility. When we view our domestic violence work in this broader context, we can think about this. What would it be like if a survivor came to us and found that whoever they are, their culture, their language, their experiences fit and made sense to them, and you made sense to her? If you were really safe and took seriously the things that had happened to her, and this last point, you accept that the person is the center of her own life, and that your role is helping her take the steps that can reconnect her with her own self, or maybe connect her with herself for the first time, connect her with her community and her agency, her vision of success, her vision of next steps, rather than being stuck with goals and outcomes that are determined by program capacity, what we know how to do, or funders, what we're funded to do. Obviously, those things constrain us. But our job is to say, given our resources and what we're expected to do, what part of this is helpful to you? And again, this isn't saying, well, with African American women, you need to use this vocabulary and you need to use these kinds of techniques, because I don't believe that there are those specific techniques. But I do believe that if you take a person seriously as who she is and honor who she is, you'll have way less confusion. If we are providing culturally relevant programs, they're applicable. That means that they're in the language that the person recognizes and can use, recognizes the social forces that the person has experienced, and takes seriously the kind of environment in which the person has been raised and the kind of environment that's important to the person. Simple example, do you in a shelter, in a residential program, offer halal food? That is, food that is appropriate for the dietary restrictions of people who practice Islam and who are themselves who keep to a halal diet. Or if you're working with Jewish women, do you offer kosher meals? Because if you are doing those things, then you are offering services that are culturally relevant. Do you have a way of speaking to someone whose first language is not English in a way that is respectful and that doesn't see her as being somehow lesser because she doesn't use the first language of this country? I back up. the second language of this country. The first languages of this country were none of them English. And I think that's a really important point as well. We think of English as being the American language, but it's not. So if you remember that the English that we bring was also an immigrant language, then we can approach anyone who comes with another language with just that same welcome. This concept of cultural humility, I think, is the primary tool in our work with survivors of color. And I want to take the time to really, I hate reading slides as a rule, but read it with me. It's a willingness to accurately assess ourselves and our limitations. What do we not have? Our ability to acknowledge gaps in our knowledge, and then being open to learning from people. If we don't have to be the experts, it's much easier. Now that means, well, why did I go to school all those years? Why did I go to training? Why not just have anybody off the street? Because what we bring is resources. We have expertise, but that's different than being an expert. Knowing that we come with a limited perspective means that we can be open and curious and proactive in saying, I never knew that. That's really different than what I expected. And that gives us a place to begin that allows any survivor to say, this person is willing to see me as I am. You know, I also want to make one other point about issues specific to marginalized communities. You know, I'm thinking about the videos most of you have probably seen on YouTube, that video about the woman walking through the streets of Manhattan where she gets catcalls and so forth. And, of course, it's really interesting that all of the ugliness comes from men of color with, I think, one exception in that video. And believe me, that's not the way it is when you're actually on the streets in a big city. But that's the makers of that video, and I'm not going to go into any more detail with that, except to say that if you are female in this country and you've ever had an unwanted hey baby on the streets and ever steeled yourself for not having the unpleasantness of someone else thinking that it's okay for them to let you know how they perceive you, then you know something about this notion of insidious micro-traumatization. And it is pervasive in the experiences of people of color. I don't think you can be a Latina or Latino in this country and walk down the street without knowing that somebody's going to look at you and think you don't belong here. I don't think you can be a woman who wears hijab, a scarf, an observant Muslim woman, and walk down the street and not have people look at you like you're dangerous. And those things matter, and they eat away at you. There's a really interesting book and study by a researcher named Donald Baumeister, I believe his first name is Donald, on the issue of willpower. And one of the things that Baumeister says that I have taken to thought of is so interesting is that the willpower that stops me in, this happened to me in, what is the name of that fan? Brooks Brothers. A really insulting interaction in Brooks Brothers. It's probably 30 years ago, and it still stays with me. And whatever it was that stopped me from calling the person behind this counter everything but a child of God took willpower. It took self-control. And that self-control is a finite resource in all of our lives. And if someone has to walk through the entire day, week, month, year of their lives, always having to hold back, they are using up energy, willpower, resources. They have less with which to face the struggles around domestic violence, the struggles around sexual violence. I don't know if you saw, I think it was Colbert in the Colbert Report, who talked about two people from his staff going into an office building in New York City, the producer in a suit and a tie, and one of the other production folks in, I don't know, jeans and sneakers. Guess who got stopped at the gate? The black man in a suit. That's what's being talked about here, and that stuff costs. The resource we use for reacting and responding and resisting wears out, gets used up. Reflective practice, I'm only going to say one thing about it. Reflective practice is the social process of doing what this young man is doing, looking in the mirror. How am I doing? How does this work? Does it fit what I wanted to do? Does it accomplish what I wanted to accomplish? Because there's value in not being certain. There's value in knowing maybe I don't quite have it all and I need to discover and learn. When we think I don't know exactly how to do this, as most of you have done in coming to this webinar. This opens the door to learning, and I really applaud you for being here to start to think, what is it I don't know? What is it I can learn? How can I move forward? And this reflective practice, reflective process is empowering for survivors, because as we reflect, we help survivors reflect as well. And in the time we have left, I want to really focus on how we use reflective questions to help us step out of our assumptions about the survivors with whom we work. And it is a technique that's especially useful when you're working with a survivor, where you know that some of your assumptions may not allow you to see what paths are wide and what paths are narrow in her life, may not help you make assumptions about what she wants and where she's going. The more you use reflective questions, I think, the more effective you will be. Just ask yourself this question. What's on my mind this week? What's gone well in my work this week? Is there anything I'd like help with this week in my work? Those are reflective questions that take us to a place of learning. I'm hoping, I do some trainings on reflective supervision, and I think it's really critical, those of you who are supervisors and those of you who have supervisors, to think about the fact that the most effective supervision asks these same questions. Not how many beds got filled, how many heads came through the door, but what's on your mind this week? What's gone well in your work this week? Is there anything in your work that I can help with? Those are reflective questions for supervision, for ourselves in practice, and they're the same kinds of questions we can ask survivors. So what I want to ask you to do is, when you are working with any survivor, but especially with a survivor where your cultural assumptions don't seem to be helping, ask yourself this. Ask her this. Well, what's on your mind about your life, your situation, your family right now? Maybe not this week. Maybe it's this afternoon. Is there anything you'd like help with? What's gone well for you this week? You'd be just amazed how, if you ask that question, what's gone well for you this week, how much you and the person you're working with together will discover about their strengths. And, of course, the next question after that is, what can you learn from that will help you with whatever you're facing right now? It's a very different kind of question than, what are your goals? Where do you want to go? How can we help you reach them? Before you offer suggestions, before you offer direction in your work with a survivor, asking questions like these. Well, what are your thoughts about the situation? And then, of course, really listen. Take that seriously. What have you tried? And explore that with a survivor with whom you're working. Because, in fact, anybody who's breathing and at your door has an awful lot of success under her belt. Because if she didn't have success, she would not have gotten to you. And that means that you can begin again from that position of reaching together for the stars. Well, how could you use that resource, you might ask? How could you use that strategy with what's on your mind, what's on your plate right now? Or when you have a goal that you have to reach, our program, you can say to her, requires me to work with you about housing. And I'm guessing that might be useful to you. What are your thoughts about focusing on housing? Well, that's not as important to me as making sure that I have clean clothes for my kids tomorrow to start school. You learn something important, and you stop thinking in terms of resistance and start understanding how your work looks for the survivor with whom you've worked. Asking questions about what you've tried, asking what's worked in the past, and using that as the foundation of your work together. It looks like we're going to have a little bit of time for question at the end, because I want to start by asking you to think about taking action, given this very, very quick overview of how you can think about your work with survivors of color, not through the lens of, oh, these are the people who are different and aren't the usual, regular, ordinary, predictable survivors, but individual people coming to you one at a time saying, what resources do you have to help me with the goals that are important to me, making the connections in my community, in my family, in my life, accomplishing the goals and achievements that matter to me and my kids, and my partner for that matter. So I want to open up to questions, because I think in the last, 8 or 10 minutes that we have, we might be able to have a useful conversation that would help us from the National Center understand how these issues, how this makes sense to you, and what would be useful for you as next steps for us in addressing the issues that we've talked about today. So Anjung, maybe I'll open up to the whole group, but to you as well. What other questions, issues, concerns might be on people's minds? And I just want to remind you that if you're going to talk about a particular situation, that you make sure to be general about a person's demographics and experiences and details of their lives so that we can focus on the issue and not on the person. So any questions or comments that might help us flesh this out in terms of your experience there in Ohio? Gee, I'm looking at the snow out my window. And
yeah, Terry, thank you so much. I mean, absolutely. There is so much when it comes to thinking about the multiple identities of someone's background and who shows up at a shelter or a program looking for services. One of the things that I work to do here at the ODVN, Ohio Domestic Violence Network, is to do all-state foundation grant work and to do economic empowerment, economic justice across the state. And the startling figures when it comes to working with African American women and Latino women and immigrants, there's a huge gap when it comes to those who are actively attempting to find work and make their economic realities different, and how incredibly challenging and difficult it is for someone who is experiencing domestic violence to get out of that situation or to seek services. When we're talking about Ohio, we're talking about, in the national average, Ohio specifically, for African American women, they make anywhere between 49 cents to 70 cents per dollar of what a white, non-Hispanic, male-identified person would make in Ohio. And for Latino women, they make 67 cents on the dollar. And so when we put into account the economic disparities of people here who are living in Ohio and trying to make ends meet, and how that impacts survivors who are trying to seek services, whether they have health insurance or if their health insurance is attached to the abusive partner, how that impacts and how that detrimentally affects survivors who are trying to access mental health services, trying to access services that systematically, institutionally, they may have already been told they are not valued or worth that service, because simply based on the fact that there is a huge gender gap around race and around African American and Latino women and Native American women and Asian American women who are not making the same amount of money for those counterparts who are white, non-Hispanic men. So
right,
I add
and if you recognize that sort of the assumptions in our culture are based on the resources that are available to white men. And
Absolutely.
if you are someone in all of the other categories of human beings, then those challenges loom in many times much larger than domestic violence. And that's a challenge that we face, because if someone is experiencing domestic violence in any definition that allows us to say, okay, it's appropriate for us to offer domestic violence services, but she's got no money and she can't get any money and she can't get a car, so that she can be ready to say no more to violence. But if enduring violence is the cost of health care for her kids, then your conversation with her might be a very different one. And leaving a domestic violence relationship is not always the best solution. That may be heresy, but I think it's true. And if you have a conversation with her that says, how can we figure out what are the goals that are most important to you? Your kid has asthma and you know he's going to the ER 3 times a month. How can we make sure that that's the least stressful it can be? Keep your kid alive, keep your kid well. And how then can we help you find a way to live with this? Not because domestic violence is okay, but because domestic violence might be less tolerable than watching your child struggle to breathe. And someone asked a question earlier saying, I get the sense that domestic violence, or I heard that domestic violence is the norm. I don't think that that's true. But I think in a culture in which people know that there's no money out there, there's no jobs out there. I mean, God knows Ohio has lost manufacturing jobs at a rate that's, would make your eyes water. Domestic violence may not be the thing that drives a person's direction in life. And this goes back to the point of well women in crisis. I am an upper middle class educated woman. The fact that I'm an African American woman aside, I've got all sorts of resources. And if my partner started pounding on me, God forbid, I have so many options that might be the worst thing I'm facing. But if we are poor, if we are worried about being deported, if we are worried about our 16-year-old son walking down the street and getting thrown to the ground by police and worse, then the fact that my partner clobbers me might be just, I can deal with that. So how do we have conversations with each other as domestic violence advocates that don't lead us to say, okay, well, that means domestic violence is fine. That's not what I'm saying. But how do we have, I'm so sorry, I've got an alarm that's going off. How do we have conversations with each other that says, how do we say that economic justice is a part of domestic violence work? How do we say that housing justice is a part of domestic violence work? And where do we engage with those other parts of our community? The funding streams in which we work in this domestic violence system are such that we have to fund our housing here through HUD, and we have to fund our domestic violence work here. We have to fund substance abuse counseling someplace else. But in fact, all of this stuff is the same stuff. And so we at the National Center of Domestic Violence, Trauma, and Mental Health are always sort of talking out of both sides of our mouth. These are all the same issues, but there's knowledge that you can bring to bear that will help with issues of emotional safety and emotional wellness for a survivor while she's dealing with poverty, while she's figuring out how do I get a car to keep my kids going to school every day. I wish I had quick answers. I wish I had a magic wand that allowed me to say, here's how you can do that. But I would ask you these questions. Who do you know who's doing economic justice work in your community, in your state, nationally? If you don't know, there's a place to start. Who do you know who's doing a good job of engaging people in micro loans and micro businesses? Because it may be that a micro business is a better way for someone to find the economic stability she needs for herself and her kids. How are your programs supporting people not to just say, gee, the manufacturing jobs are gone and the service jobs are right behind them, and therefore people are going to be out of work, and instead to ask, what do people do? I asked a question once in a training, and it was something that kind of came to me off the top of my head, but I learned something from it, which is that I asked, who do you know who's really good at being poor? And, the audience kind of looked at me like I was crazy, but a woman in the back raised her hand, and she said, we were always poor, but my mother knew how to make a meal out of very inexpensive foods. My mother knew how to make sure that she found every service that was available for us. My mother knew how to go into the welfare office and talk to people in a way that was going to make them do what was needed to keep our family together. Some of you may have seen that movie, Precious. I have really mixed feelings about that movie, although as an actor I look at that and think amazing performances. But there's a scene in that movie where the highly abusive woman who's played by, what is the actress's name? Help me out, somebody. The highly abusive woman, the mother of the young girl, Precious, puts on her wig and puts on her lipstick and her smiley face when the social worker walks in the door. And that may seem really wrong in the context of that film, but that's also adaptive. There's a question here. Are the cultures that we work of matriarchal? Do women connect with each other? Well, sure. And I think that that term matriarchal sometimes gets used in a pejorative kind of way. But yes, many of the things that survivors of domestic violence of color come with are things that may not be, that we may think of as unfamiliar, but may be at their fingertips already. I think that's the point that the person is typing into the chat. But my point about being poor is that knowing how to live in poverty is a skill. What do you know about how to live in poverty that you can help survivors learn? If you don't know, you might ask, what does it take to live successfully as a poor person in the United States? Some answers to that question might be very useful in your program. And, this is a kind of offshoot, I think, or unintended side effect of the professionalism of our program, professionalizing of our work. As the people who operate domestic violence programs, increasingly the management and staff are people with advanced degrees. We are not the people who know how to live as a poor woman struggling with domestic violence. Originally, the folks who ran domestic violence programs, who built domestic violence programs, were not people with degrees and not people necessarily with higher educations. And when our programs value that kind of economic status and educational status, we disempower knowledge that is crucial to the lives of the survivors with whom we work. Someone's making another point in the chat window, and let me see. I think you can all see these points, so I may not even have to comment on them except to say that this question, help me understand how I could help you and your children, your family. And absolutely many times people want to include the partner. There's a wonderful program in Georgia. I can't remember the name of it right now. It's Julia's program. Help me out, Jen, if you would type it into the window for me. Julia Perilla is doing some really wonderful work with Latinos and Latina survivors of domestic violence. And she says, she's a psychologist, and she learned from the survivors with whom she worked that she could not divide families in the service of addressing domestic violence, that they really had to be able to understand how do you work with whole families. One of the points that the folks from the Full Frame Initiative make, and it's a useful point somewhere in their report, is that approaches that were developed to be responsive to culturally specific services turn out to be useful for everybody. Programs that know how to respond to the survivor who says, I don't want to leave my husband, I just want him to stop hurting us. That's an answer that anyone might give, and an answer that we have to find a way to be responsive to. The program that I was referring to, that I could think of the name in English, yes, it's Caminar Latino. It's Latin Road, Caminar Latino. And it's in Georgia, and it might be useful to look at their website and look at some of the materials from Julia Perilla as well. Someone's making a really great point. Surviving poverty is often seen as being manipulative and using the system. And that highly offensive term, welfare queen, which just makes my flesh crawl. If you are poor in this country, it is really hard to stop being poor. You have no idea. And so we have to understand that it is not manipulative to know what to do to keep your kids fed. We could go on and on with these conversations, and I hope that you will continue to have these conversations. And I know that Jen and Erin and I will be talking about how do we take these comments and concepts and move forward with them at the National Center. But I thank you all in the last minute for your attention and your interest in the issues that we're talking about today. And again, I refer you to the National Center's website. Please feel free to email me separately if you have questions or comments, and I believe that there is an evaluation at the end. So, Anjung, with that, I'm going to see if I can figure out how to turn the microphone back over to you. And I thank all of you for your attention and for the hard work that you do in working with survivors.
Oh, my goodness. Thank you so much, Dr. Pease. I can't say again how much the level of information and compassion that comes through in the work that you help to educate so many providers and mental health specialists and all the advocates who have been present at today's webinar. We are so incredibly grateful for your information. I also want to make sure that folks know that, Jennifer Curley and Erin Tinone did an amazing job of providing technical support and coordination for today's webinar. We also want to make sure that we thank the Caption Colorado for providing today's closed captioning especially for those who need assistance in terms of being deaf or hard of hearing and require visual assistance. Closed caption is incredibly important when it comes to access for these kinds of excellent webinars. So absolutely, we would like to thank you, all the participants who joined us today. We will be sending out the recorded webinar for all who have attended this afternoon. We will also make sure that there are additional resources that we mentioned this afternoon in our chat feature. And if there are any future questions, we are also incredibly interested in learning about other people's interest in what kinds of trainings would be helpful and beneficial to best practices with working with so many diverse populations of survivors who are experiencing domestic violence in Ohio. So thank you so much to everyone who has joined us, and thank you again to the National Center on Domestic Violence, Trauma, and Mental Health. And thank you again, Dr. Terri Pease, for your incredible knowledge and for all the work that you've done. We are so appreciative from the State Coalition here at the Ohio Domestic Violence Network. And hopefully everyone will join us for the next training, which you can absolutely go to at our website at www.odvn.org. And if you take a look, you can also make sure that my email address is also available at unjungl@odvn.org. That concludes our webinar this afternoon. Thank you so much for everyone joining, and have a wonderful day, and peace be with you.